Hi, I'm Lynn Dooley, and this is Proposition 8. You'll see it on your ballot as regulates amount outpatient kidney dialysis clinics can charge for dialysis treatment. The question, should outpatient dialysis clinics be required to rebate money to private insurers if their revenue exceeds allowable costs by more than 15%? The situation, people suffering from end-stage renal disease will die without dialysis or transplantation. Patients need 3 4-hour treatments per week. The clinics are licensed by the California Department of Public Health using federal certification standards. Approximately 588 licensed clinics operate in California. The majority of the clinics are owned and run by one of 2 private, for-profit companies. The estimated annual revenue of the private companies is $3 billion. Most dialysis is paid for by Medicare and Medi-Cal. These programs pay a fixed rate established by the regulations and are close to the average cost of treatment. Private insurers also cover dialysis with payment fixed rates by negotiation with the providers. On average, these rates are multiple times higher than that paid by the government programs. The proposal. This proposition requires the companies to rebate to mostly private insurance companies if the clinic's chain's corporate annual revenues are more than 15% higher than a cap defined in the proposition. The cap is based on the total allowable costs of, quote, direct patient care services, unquote, and healthcare quality improvement costs. Federal law mandates certain staff and allowable expenses. Adjustments to the amount of the cap are allowed if the clinic owner-operators prove to a court that the revenue cap is so low that it is an unconstitutional taking of the value of their business. The challenger bears the burden of proving what cap would be appropriate. This proposition proposes that clinics are prohibited from refusing treatment to patients based on the source of payment for care. The fiscal effect. The fiscal impacts of this proposition are dependent upon the response of the clinics to it and on interpretations of what allowable costs are by the Department of Public Health and the courts. It appears that initially rebates will be paid, which reduces the profits of the clinics. The impact on state and local governments varies from a net savings of tens of millions of dollars to a similar net cost. A yes vote means that dialysis clinics would have their revenues limited by a formula and could be required to pay rebates to certain parties, primarily health insurance companies, that pay for dialysis treatment. A no vote means that dialysis clinics would not have their revenues limited by a formula and would not be required to pay rebates. Supporters say that Prop 8 provides incentive for dialysis clinic companies to lower their costs and improve the quality of patient care. When insurance companies are charged less for dialysis, the overall cost of insurance may decrease for everyone. Supporters include the SEIU Service Employees International, United Healthcare Workers West, California Democratic Party, the Green Party, CalPERS, the Southern Christian Leadership Conference of Southern California, and the California Labor Federation. Opponents say that Prop 8 sets arbitrary limits on what insurance companies pay for dialysis treatment and will not cover the complete cost of running a clinic. Clinics will reduce operations or close, depriving patients of access and increasing the risk of poor medical outcomes. Opponents include the California Chamber of Commerce, the California Hospital Association, California Medical Association, the National Kidney Foundation, and the California Republican Party. Also opposed are the San Francisco Chronicle, the Marin IJ, the Santa Rosa Press Democrat, the Sacramento Bee, San Jose Mercury News, and the LA Times. Campaign funding to date includes Californians for Kidney Dialysis Patient Protection, the SEIU United Healthcare Workers West, contributing a total of $18.5 million in support. The California Dialysis Council, consisting of patients and caregivers to protect dialysis patients, consisting of the 4 dialysis clinics, have contributed $99.4 million in opposition. Thank you.